Luckily,
Are we live?
Are we on the air?
All right, here we go.
Good evening and Happy New Year, Melrosians all around the world. I'm Tom Catalini.
I'm Jen LeClaire.
I'm Sam Hammer.
And I'm Tom Shampoo.
And this is Let's Talk Melrose. Melrose, a show where Melrosians talk about Melrose, and Tom Shampoo is firing on all cylinders out of the gate.
I am ready to go. Happy New Year, everybody. We're so thrilled
Happy New Year.
to have a new year with 2021 behind us. Okay, Jen LeClaire, trivia questions. Ready?
Oh, gosh. Okay.
1994, Hugh Grant movie, Blank Weddings and a Funeral.
4.
Excellent job. Sam Hammer,
Okay.
you ready? All right, R.I.P. Betty White. How many Golden Girls were there?
4.
Oh, great job. Tom Catalini, how many square miles is Melrose?
4.
Excellent. 4.8, actually. Close enough, though.
Oh
Four is our
God.
magic. Four is our
Magic.
magic number tonight. And why
Okay.
is that magic number, Tom Catalini?
It's a season of power and prosperity. Yes, it is. It's a new season,
Yes.
and it's coming to me. Or if you believe that, lift your hands and say,
Yes, it's season 4. Let's Talk Melrose.
Awesome.
The show that
It's
nobody
so great.
thought would go 4 episodes has gone 4 seasons, and there's only 1 season a year. Unlike Mother Nature, we only have 1 season a year. This is episode 109.
Here's my question. What makes a season, by the way? Because I'm totally confused as to how it is. It just a new year? Like
So
Yeah.
we workshopped it. We did the focus group thing. We worked with the data analytics team, and what we decided was to sync up with the calendar that we all use. So every time there's a new year, there's a new season of Let's Talk Melrose. Melrose, we
Okay.
started in
Fourth
September.
season. Wow.
September of 2019, right? And then, so that was season 1, 2022, 2021, 3, 2022, 4. Wow, a lot of
Okay, here
math
we
on
go.
this
Look
week's
at that.
episode.
Look at that. Look at that. All right. Well, great job.
Fantastic. All right, I
everybody.
think it's time for some new merch.
Oh,
no kidding.
yes. What should it be?
Oh, just new quotes on the T-shirts. New, I don't know. We'll think about it. We'll
How
figure it
the
out.
hell did we make 4? That's what it's going to be.
Probably masks, maybe.
Well, listen, before everybody
Yeah.
tunes out, because they've enjoyed the celebration, we
Right.
have Anthony, is it Chui? Is that how we pronounce his last name?
Yep.
On the health director of Melrose and Wakefield,
Wakefield.
on the show tonight. So stay tuned for that. Lots to talk about.
A great conversation.
coming up.
Everybody, everybody. Once again, the topic. Everybody's concerned and talking about COVID, so we went straight to the source, and we've got lots of questions. So we're really appreciative of him being here. So stick with us. We're gonna breeze through the news really quickly and stick with us because we're gonna get Anthony on really soon. And we heard he has breaking news. So
Wow.
tune in, Karaji.
Yeah,
Yes,
Karaji
somebody
better be watching tonight.
Yeah, text that guy quickly. Also, I just want to say next week is also going to be really great. My new friend Ward Hamilton will be coming on, and we're going to be talking about a few things. One is the Transparency Group Initiative is having a conversation around the MHS mascot and identity, which will be happening on January 12th, the night after the show. And also, he's on the committee for this school committee of the vocational school. So the Melrose, the Northeast Metro Tech school is. They're going to be having a vote in Melrose to see if Melrose is up for putting in our share into paying for the
Who's they?
renovation.
Am I going to a ballot box? Who's they? Who's voting?
They is you. You are voting.
Yeah, we are.
Yeah.
We are
All
going
the
to be voting.
citizens?
All
All
the
the
citizens.
citizens.
I'm gonna go out on a limb and say I bet not too many people know about this.
Well,
That's the first I've heard about it.
they will.
Right.
People are going to start talking about it. I saw it. I quickly saw.
I would think-
it might have been in the
think
past.
Patch.
I would
I
think
think
that's
the
like
patch
city,
thing, yeah.
city council going to vote. Like everybody's going to walk over to the middle school and vote. Wow.
Yep. And the hours are different from regular voting hours. It's 11 to 6 p.m. But here, I'll put the patch article in and the information. But it's a cool project. So
it's a cool project, and I just thank you, Sam, for bringing Ward on for both. I mean, he can talk about both those things, so it's really timely. Great guest for us to have next week. So I'm looking. I'm looking forward to it. We are on top of it
on all cylinders.
So
Season
far,
4.
so good this year, you guys.
It's like even better than Netflix. You know, after like season 3 of Netflix, they kind of peter out. We're like going up.
We're
to
just
the next level.
It's completely on the upswing here. Sam, tell us again the vote, the day of the vote. Just so folks can hear that again.
Tuesday, January 25th, from 11 a.m. to 6 p.m. at the middle school. And yeah, it's a kind of a cool project. And to Tom's point, like not too many people know it's a thing. So
right, yeah. But again, you know, having like Ward, I know that Ward knows a lot about both these things, and so I'm appreciative of having him on next week to help us sort through some of these things and both the information and the important conversations that we need to have here.
Have you guys met him yet? Does anybody know him?
No, I don't.
Yeah.
Oh my God.
Zoom for some maybe it was like a cultural council and historical commission conversation about something. I can't remember, but
yeah,
it's nice.
Yeah, we had our coffee lasted like 3 hours. It was awesome. I know.
Yeah,
it was awesome.
Cool. All right,
we ready?
Yeah,
we're ready.
Okay, and now it's time for the news.
Well, I think we know. We'll just breeze through this really quickly. You know, all the
season three of the pandemic, unfortunately.
Right? Yeah, exactly. Yeah, no kidding.
Yeah.
You know, most of the news is COVID related, so we're just skim through this because we're going to get the real facts and get some questions answered in a little bit. But just basically, we know that the Omicron variant is kicking some butt. The numbers are rising like crazy. There's a new, the mask mandate has been reinstated in Melrose. The schools are so far doing a good job as far as we can tell. But it's inevitable that the numbers are climbing. We're getting, I have a high schooler, we're getting numbers, emails daily about the number of cases. There's a significant number of Boston public school teachers who are calling out. So it's something we really need to look at. It's hard to find tests anywhere. The lines at square one are insane again. So it's challenging right now. It's really challenging right now. It feels like a kind of a gut punch to go back to the way it felt, a year ago and or more. And I think that's hard for people. It's a bit traumatic, I think.
I'm really excited to talk to Anthony, and we'll get through the rest of the news and bring him on because it's the same but different, and things are happening faster and going in different directions. It's a little more wild right now.
Over the 18 months that we've been going through this is the first time that I feel like I've known many people that are positive in the test, right? So before, like somebody else or somewhere else, but now it's like people we know, and now it's people in our families, and so it really is having a bigger impact, I think.
I'm anxious to have that kind of, to get the facts and the information from Anthony, and also have this conversation about like what it feels like, because my sense of it is the same. There's part of me that, I'm continuing to be careful and do all the things that, the way we have been the whole time. And then there's this other part of me that's, a little bit like, okay, I'm just braced. I'm like, all right, I'm ready. So anyway, we'll talk about that.
Yeah, I'm interested to get into it and see where we go with that.
Two other quick things. Sam, you want to grab the next one?
Sure. So the City of Melrose's diversity, equity, inclusion audit is having their access. Oh my God, I can't do this tonight.
Diversity, equity, access, and inclusion.
They're having community focus groups, and so I'm going to put up the link during January, and it will be facilitated by Visions, the consulting partner doing this very important work. The focus groups will be limited in number. There'll be 50-minute slots for folks, and you can register for just one of the groups. And the process is designed to collect information about the racial climate in Melrose, including strengths, challenges, desired outcomes, and provide a chance for participants to share their experiences. So it's great. I'll put the link in for folks to sign up if they want to be a part of one of the focus groups. So there were some questions about, I don't see myself or my group identified in this list. Where are these folks in this list? So a little bit of that's been going around, because I think it's hard to capture everyone, but if we could allow for a way for everyone to at least mention that they could be represented there, that would be nice. But
so, who I'm anxious to share this with is some of the kids we know that are like in college. So like my kids. So there's just an interesting perspective when they grew up here recently and moved away and are living someplace else. It really, then they come back with it. I've just heard some very interesting things about the perspective and some of the positives, a number of negatives, some of the critique of the inconsistencies, maybe talking the talk, not walking the walk. It's just really have gotten an earful from folks in that position. But it's, I don't know how easy it is to engage all the right people into something like this. That's probably part of the challenge.
Right.
Yeah.
Right. So I know it's been shared. Obviously, I can see it on social media, but hopefully folks can share it widely.
You know what? We could do one of those viral TikToks and get the word out.
A new dance, the Catalini.
The first I think survey that went out, this went out first, but before this, the first sort of survey went out, said something about, it was called like a climate survey or something like that. And so you kind of missed what it was really about right away, I think. But this is different. And I
didn't know what the transparency group was until I badgered Sam for like 10 minutes before the show. So the name of your initiative or group or survey is important.
Yeah.
Yes.
I mean, look, that's something we could teach the community, right? Let's talk Melrose, a show where Melrosians talk to Melrosians about Melrose. I don't know how we could be more clear than that.
Yeah. But it was one person pointed out earlier that there's a section for people who just moved to Melrose of any kind, people who just moved, but there isn't one for people who have already been living in Melrose forever. Or there's certain religious denominations and not others. Right. So it's hard to like capture everyone, but I would have loved like an open-ended part in there that says, do you identify separately from all these other things? Like, please let us know, and we'll see where this your input is valuable. So
I think that's really interesting, because something Tomcat said earlier made me think of kind of along the same lines. Like, not only when our students have kind of grown up here and sort of move away and come back and see their community through a fresh lens, but I think it does depend on how long you've lived here and at what point in your life you move here, right? Yes. So even if you've just moved here, if you've moved here with like little kids versus if you sort of move here, later in life, or, all those things impact your perception of your community. Your experience of your community is going to be through this lens that's kind of like at your moment in time in your life, right? So I think that's really interesting.
Somebody tipped him off. Somebody tipped him off to catch the news tonight.
Happy New Year, Karaji.
No kidding, huh? Yeah. We need, speaking of New Year, we need to move on as a guest, and so I want to make sure.
Yes. One last quick thing. I also want to give, but yes, you're right. I also want to just point out and give people give a quick shout out to Melrose Education Foundation Parent University workshops are happening through January, including one tonight, and they're I love this slate of topics. They always really are timely. They do a really, really great job. They have excellent speakers and experts. They cover all age groups and all kinds of things. And this particular set is just so timely for the time we're in right now. So tonight, unfortunately, you probably already missed it, but they did one, Waiting for the Light to Come Back, Supporting Depressed and Anxious Teens. My God, how timely is that? I wish I could have seen that one. January 18th is An Evolving Understanding of Gender. And then January 20th, The School of Hard Talks, How to Talk to Your Teen or Young Adult. I really, really appreciate the focus on some of the older kids at this moment in time. Obviously, I'm biased because I have teens, but kudos to them, and we'll get the link up. Definitely attend some of these online if you can. They're all virtual, very accessible. So shout out to Melrose Ed Foundation. Thank you guys for doing this.
Yeah, it's great. And not only, we talked about the youth risk survey, but also in all the COVID news and the back to school thing, it's a very, very clear case comes across for, keeping kids remote. It does different kind of damage. There's a lot of risk and there's a different kind of damage done in that realm. And so, it's again, when you talk about Jen before, like this feels like it was a year or 2 years ago, it's the same, but it's also very different. And I think, anyway, we'll get into it with our guest because I think opinions, including mine, are evolving. All right, let's bring in our health director.
Hey.
Anthony, welcome to the show.
Hi, Anthony.
I think
You're
he's
muted. Unmute yourself, Anthony.
I am not a cat.
Right. Don't let us start speaking for you.
Thank you so much for coming on. So I met Anthony at the booster clinic like a week ago, 2 weeks ago. I have no idea, no concept of time. And I was so happy that I was able to make the time to do that. It was very well run, very organized, and actually kind of fun and jarring to like actually see that amount of people in person again. So thank you for your work there. And how has it been going for you since you've landed here in Melrose
and Wakefield? We should point out we have to share him with Wakefield.
Yes, we do.
But you landed here in this new job in the middle of a pandemic. So go.
Yeah, sounds good. So again, Happy New Year to everybody. Thank you for having me. I will say, the experience landing here in Melrose has been great. Everybody here has been very supportive, and this community has just really come together, I think, to support each other during this difficult time. Myself landing in the middle of a pandemic, everybody else is still dealing with it. So I think, everybody is very understanding, and I think we're working as a good team right here. So, all the folks in City Hall, all the citizens that, email us and let us know about what, what's been going on, what affects them. I think, it's been working out really well, and we're trying our best to make sure that we're reaching everybody and helping out as much as we can.
So you started just a few months ago, correct?
Yes, that's correct.
And so I'm curious, like when you came into the role and started to get your footing, where did you start to see opportunities and where was your focus? And then how did that all get upended the last couple of months?
Sure. So when I first stepped in, I think the department was in really good shape. Everybody who was already there is just so full of institutional knowledge, and I think there was lots of support from administration as well. So, give a big shout out to Mayor Broder and his team. They really do have a great sense of, how important public health is and how if we move together in the same direction, we can accomplish a lot, right? So coming from, a background of epidemiology and having some experience in substance use, my focus really has been to focus on community health as well as, helping out to deal with COVID here in Melrose and the surrounding area. So I don't know if it's too early. Can we break some news to start and then?
Yes.
Oh, yes.
Now we can.
All right.
Get your notebook, Karaji.
So we're very excited to announce. So previously known as the Substance Use Coordinator, we've actually hired a new position. We've changed the title a little bit and the scope, but this new person is falling under the title of Public Health Specialist. Her name is Emily Hachul. She comes from us from Lynn. Very, very qualified. Just a great mind for substance use and brings a lot of experience with her. And we're very excited to bring her on board. It's something that in the past Melrose has been kind of a model to follow, and so in the past few months or years, we've been trying to get back a little bit on track here. And there's no better time than now with the pandemic going on. Understanding that there's a lot of other issues that are still happening in parallel. And so mental health, substance use, these are all things, and including social media use, screen time, everything that goes along with it. We are very lucky to have this position filled with someone so qualified, and we want to make sure that we can help the community out and just make sure everyone knows that we're on board.
Do we have to share her
great
too?
news.
Do we have to share her too?
No,
That's a
so
good
she
question.
is a Melrose specific position here.
Awesome.
Yes.
Yes.
That's fantastic. All right.
Building upon some of the things that are already in place, we have programs, we have great partnerships in the city already. It's really just a matter of getting everybody together at the same table and making sure with the schools and everybody else to make sure that we can all share resources and be aware of other things that are already out there.
Right.
That's great.
So
great news. Go ahead, Tom.
You've been here just for a little bit, and you came obviously in the middle of a global pandemic. So how have you been able to prioritize the things that you want to do, knowing that there are things you have to do immediately, and there's a person that you hired in the middle of this as well? But how are you able to prioritize all the different things you want to accomplish in the first year or first half of the year?
Sure. So obviously, first couple weeks, it was definitely a little bit, floating out there, trying to figure out exactly how to get started. The immediate response was obviously to have COVID concerns dealt with, so that's testing and COVID vaccinations, and that wasn't as difficult because for my previous position, I had already had experience with this, so that was an easy place to start. To prioritize what we wanted to do. One of the things that a lot of health departments, just in general, can really benefit from is the strategic planning process. And part of the strategic planning process is we lay out some of the goals that we're hoping to achieve, both in the short term and the long term, and then we do an evaluation, of what what assets we already have in the department, right? And then having that basically, nobody really wants to admit that they're not covering certain things or certain areas, but as part of that successful strategic planning process, you have to really evaluate what you're missing out on, what you're not covering, and that will really help, show that there is a need for certain places. So I think the strategic planning process has been ongoing, even though we've been, doing booster clinics and, helping schools reopen and making sure that, we're covering the basics in terms of inspections and keeping, people safe in the community. I think this community planning, the strategic planning process is just something that's been happening in parallel. So we're working on it piece by piece right now. And so that once we have that all set, we're going to be ready to go in one fell swoop.
Great.
That's great. Can you talk to us? I think at this moment in time, it feels like we've fairly rapidly gone back to a place of a lot of concern, and where things are changing daily. There's some unknowns about services and this, how the Omicron variant being so much more contagious is going to impact schools and services and our health, and the mask mandate has just been reinstated. All that, it feels like we're moving quickly again, and people are confused and fatigued with all this. So can you just kind of talk to us about like where we are right now? What do we expect with Omicron? What do we need to be doing? What should we be concerned about? Just fill people in on give us the tutorial of kind of where we are right now.
Sure. So we're not necessarily still new to Omicron. It's now been around for a little bit. We have a slightly better understanding than we did in the beginning. There were concerns originally, to see if it was as serious as Delta in terms of infection and consequences after infection. It's been back and forth. It seems like at the moment, based on the data, it is slightly more mild in manifestation, especially in those that are vaccinated. 1 shot, 2 shots, or a booster. And so we do know that Omicron is very, very contagious. And so even with all the masking and the social distancing, we want to make sure that we're taking advantage of the kind of full toolbox that we have at our disposal, right? So we would say the masking is one strong tool. And this masking does not come with conditions, right? And so not all masks are created equal. We would say, gaiters or, cloth masks may not be enough on their own. And so we are definitely, we're definitely not afraid to come out and say that, right? That's not sufficient really to provide full protection. Obviously, and something is better than nothing, but we would say the surgical 3-ply masks, the ones you see very commonly around, those still offer a great amount of protection. Those in combination with a cloth mask, it's really about, first the mesh that's provided by the 3-ply mask, and also the seal that's created on the face. And so, nobody breathes through their chin. So a nose and a mouth being covered is definitely the best way to go, right? So if we're able to cover the mouth and nose and create some sort of seal around, it's definitely provided the most amount of protection. N95s and KN95s, these are kind of the gold standard in terms of masks. These are,
that's my go-to
professions. Yeah, right. So these are also very high quality masks. Usually on their own, they're actually very protective. And so that's, if you have access to these, we suggest that. The surgical 3-ply with the cloth has been very protective as well. That's what I take into stores. For anything that we're doing in close proximity to others, make sure that we wear these as well.
So we should point out the mask mandate has been reinstated temporarily in Melrose. But I would also ask, we know a little bit about the efficacy of the masks, and that some are better than others. But we're also at a moment in time where they're off the shelves. They're flying off the shelves again. It's hard to find them, and it's hard to find testing. So what do you say to folks who, you referred to the toolbox. We know what the tools in the toolbox are, but people are struggling to access the tools in the toolbox.
Yeah, so I would say, as part of that, the masking, it is sometimes at points difficult to find the KN95s and N95s, right? Those are, somewhat more expensive than the 3-ply masks. The 3-ply masks generally, at least from what we've been seeing, hasn't been as difficult to order, and they usually come, in larger boxes. So I would say that's probably a good way to do it. If there's ever a concern about getting a mask or not being able to afford it, you can always reach out to the health department. We're definitely here to support you. And so if there's ever you're in a pinch and you need it, we can always help provide that. I would say as part of that toolbox, the mask mandate, and this is not without controversy, but I would say there's a lot of evidence out there that suggests that the masks do provide protection for the person that's infected from spreading, as well as someone from getting it. That doesn't happen right now, right? And so, sorry, go ahead.
No, go ahead. That's fine. I can finish up.
Yeah. So I think with the mask mandate, the idea is really around education, right? We don't want to be the mask police. We're not out here to penalize people. And at the end of the day, we're just asking folks to cover their nose and mouth for the safety of others, right? And so, as much as we would like to see everybody masked up, we're going to make sure that we are making masks available, as well as educating folks on why we're doing this. And the whole end game here is we're not going to have the mask mandate forever. It's not going to be here forever. It is a temporary measure. And the mask itself is not going to drive the pandemic out. It is really just a way of keeping the numbers low. And I think during the mask mandate meeting, we had a guest. His name was Dr. Spardella. He's the chief medical officer at the Melrose Wakefield Hospital. And I think one of the things that resonated most was the ICU capacity. And so, generally, we don't really think about it on a day-to-day basis if you're not working in healthcare or in those settings. But if you think about it, even with a more mild infection for Omicron, there's still folks that are getting it, serious consequences. And so if we're opening that pool from, hypothetically, maybe like 300 before Omicron, Delta infected, if we're opening that up to a lot more folks, even though there's more mild cases, now we're, assuming if 1% end up in the hospital at 300, 1% of 3,000 people that are infected, that's when the issue in the ICUs gets to be a problem.
So we have a related question here. Director Chui. So can you comment on the relationship you have with the Melrose Wakefield Hospital, which you just alluded to, and do their numbers help inform your policies in the city?
Yeah, so in this time of transition, we're definitely in conversation with Melrose Wakefield. I really do look forward to forming a very strong connection, with our department and Melrose Wakefield for the city as well. And so we're using, their guidance as part of our decision making. As we know, Melrose Wakefield serves a large part of our population, and I also work for Wakefield, so I get to see the relationship that it has with both cities. And so, in the short answer, yes, a lot of it comes from their capacity to help take care of our residents.
We had another. Another question. I wanted to get to this one because we talked about testing, and if you can find a test, and I think I heard you talk about this on the Broder Bulletin, another MMTV production you were on recently, and I think you mentioned you might be launching something in this realm where if somebody tests positive in their own kit, like what should they do?
Right. So so that seems like two questions here, but I'll answer this one first, and I'll go back to the positive at-home test. So basically, I think for folks that test positive with an at-home test, we want to make sure that everyone understands they don't get entered directly into the database, right? And so when you take an at-home test and you get a result, we don't really know that you did it. So what you have to do is you have to call the Melrose Health Department if you're looking for instructions on how to, conduct isolation, quarantine, and close contacts, right? So our number can be found on the main page, I believe, on the City of Melrose website. So I think, for us, we want to make sure that folks have the correct guidance, and there's been a lot of changes recently about what to do when you're positive.
Yes.
And I think that's a big part of it. The reason we're asking, and to be totally realistic, I know the PCR test is difficult to come by nowadays. There's a lot of wait times, and you have to kind of go out of the area to find it. The reason why the PCR was pushed at first was because that test gets automatically entered into the state database, and then our contact tracers can automatically see the information and reach out and appropriately, triage and figure out what questions there might be. At this time, because we are getting all these at-home tests, and we don't really have a mechanism to keep track of at-home tests at the moment, the state numbers are going to be slightly underreporting. So if we're looking at all of these numbers currently, we're actually at a lot higher than we think. We're trying our best, especially in the school environment, to keep track of all this data.
Yeah.
But what we can say is the numbers right now, we're undercounting, and even at that stage, we are much higher than before.
So people do not need to report any at-home tests. There's no way to capture those reports.
So for the general community, we haven't had a way to capture reports because we actually cannot enter at-home tests into the state database because it's not proctored and we can't verify. For the schools, we do have a mechanism. So for the school community, anybody who tests positive can enter, and there's a Google form link that was sent out by school communications. It was a newsletter. For any students or staff that tested positive over break with the positive antigen test, they can enter, and that's how we're keeping track of that data.
Is that available online also, the school's website or anything? I mean, emails get lost and buried. How do you go back to that if you can't find it?
I believe it's on the school website, but we can definitely check on that afterwards.
All right, so there's two things I heard about this. One is if you test positive on the at-home antigen test, you're presumed positive. So you don't really need to go wait in line in Saugus other than to get into the database.
So they're more reliable now? They're better?
No. Wait for my follow-up question, Jen.
Okay, sorry.
I had a two-part question.
Okay.
So that was one thing. And the other thing that it's changing every day and we're struggling to interpret it. But it is if you test positive, you are positive. And it's also, there's been some discussion about the reliability that I'm trying to wrap my head around, but it seems like if you get the antigen test, that's the best indicator of whether you're contagious or shedding the virus right now. So like we had somebody in the house that tested positive on a PCR test, and the Melrose Health Department called and everything worked as it should. They also subsequently tested negative on an at-home test. And then I'm like, I don't know what to do. Then we went for another PCR test, and we went through the CDC website, which has, granted it has information, but I studied it for quite a bit. It's not that easy to parse. Like it doesn't account for a household of 5 people and what is a close contact and, all of this stuff. And so we were trying to use the testing system, and it was a little bit difficult. And now the CDC has changed it from 10 days in isolation to 5. And there's rumor, even Dr. Fauci was saying, like they might add a antigen test to that. So it seems like we're maybe heading in a direction, if you could get access to the antigen test, that's not a bad way to go in terms of telling if you're contagious right now or or when you're sort of past the threshold. Does that make any sense? Is that accurate?
It does make sense. So as part of it, the antigen test in a vacuum is very good at telling positives, right? So if it's a positive, we're pretty sure that you have it. And so the antigen test will pick up, especially if you are still in that infectious stage. There currently is no CDC guidance specifically that says if you test negative from it, then you're no longer contagious. But that is generally, because it is a less sensitive test, and you're probably shedding a little bit less. But In terms of the new guidance, which is now 5 days for isolation and 5 days for quarantine, it does say testing if possible. We are asking folks that if it's possible to test on day 5, and day 5 being that operating day that is still, the most likely to catch an infection, we will say that's still the best idea.
Yeah.
Can you remind people the difference between isolation and quarantining?
Yeah,
that comes up a lot.
Absolutely. So if you test positive, the protocol is to go into isolation. And isolation is basically, staying away from others, to be practical, wearing a mask if you have to, you have to interact, say, in a household or something. Try and stay away from everybody. Isolation is 5 days now. It used to be 10. From depending on when you have symptoms or when you test positive. There's a lot of folks that don't have symptoms, but whichever came first, the symptoms or the positive tests, you would count from day 0 and you would count 5 days. So let's just say you were tested positive on Monday. You would say Monday is day 0. You count Tuesday as day 1, Wednesday, Thursday, Friday, Saturday. I don't know if I counted correctly. I think Saturday. Saturday would be day 5. Day 5 would be Saturday. And then so you can exit isolation on day 6. With the new guidance, it says that after you've been isolated for 5 days, the following 5 days, you should be wearing a mask at all times around others. And so the thinking there is that you could still be contagious, and an antigen test, even if it tests negative, is not foolproof. And so we would say at least keep the mask on full time around others, for 5 more.
Okay, here's the monkey wrench we ran into, and we did the 10-day isolation thing. So it was right before they changed the rules. But we also learned that the PCR test could show positive for up to 90 days. And they actually didn't recommend continuing doing any PCR tests. You just, after you've done your time, you're sort of free to roam the earth. And in some ways, you're a little jealous of the person who went through that process, because they are, in fact, for some period of time, free to roam the earth without worry about catching it or spreading it. No, really, like I was like, you were talking at the top of the show, Jen, about like evolving your opinion and changing the state. Like part of this seems to be like, okay, everybody, use your best judgment. Go. Good luck. And also, I would add, like, we talked about the tools and the toolbox and this and that, but I can't make any sense out of it. There are some people who have come down with this thing that I can't imagine how they got it, and there are other people that I'm shocked that they haven't gotten it.
Right, exactly.
So it's not always sort of, you can use those tools, but that doesn't fill 100% of that pie of whether you're going to get this thing or not.
We have a question that's I just want to bring up here so people so you have a chance to answer that, Anthony. If a student tests positive, what is the current policy on when they can return to school? Is that 5-day window that you mentioned? Or is it something different for the kids at school?
Right. So if they test positive, currently the guidance is to isolate for 5 days, and they can return on day 6 if they have resolved symptoms, or at least their symptoms have improved dramatically. And so, as you can see right there, the wording's a little bit blurry there. So we want people to, use their judgment. If you're coughing through your mask at day 5 and you keep it on, but it's flying off your face, maybe don't come back yet. But essentially, we want people to use their best judgment and say, after day 5, monitor for symptoms, keep that mask on, and that's the best.
Okay, I have another judgment follow-up question to the masking. So I'm KN95 because I figure that's the way to go. It does cost a little bit more money. I've had good luck sourcing it through Amazon, which is probably destroying the planet every time the guy brings a truck around. But he's coming to bring Sam stuff anyway, so I figure it's not that bad. But anyway,
I get those direct from Bezos's spaceship.
He just sprinkles them every time he goes around. He sprinkles a few down into your house. All right, so I'm using my own judgment as to, like, when do I throw this one away and use another one? Should I be using one a day, every few hours? Does it depend, on if I'm in the workplace and I'm wearing it all for 8 hours? Do you have any guidance on how?
Depend on what you've had for lunch, all that stuff.
Yeah. I've engaged the LTMM data team. I've given them all the variables. They're doing a breakdown. But I want to see what the health director has to say.
Yeah, so I will say the surgical free-ply masks are supposed to be one-time use, and so we do require people who change them every couple of hours just to make sure that it's not wet, it's not really damp. The KN95s, I would say, I would wear mine throughout the day. If I'm on and off, I'm leaving the house, coming back, or leaving the office, coming back. So really, it's just keeping track of that and making sure that we change it. I generally change it once a day at least, but I can see from your faces that you probably don't do that as much.
Well, it's interesting. You're talking, not to get too specific, but you talked about the inside of them.
If it's changed colors, I would say change it.
Yeah, well, you talk about, I don't know if I should talk about the dampness or not, since you brought it up. But I'm trying to gauge on, if you have it on for a long time, is a certain, je ne sais quoi about.
Okay.
On those, let's say on the heavy days, I've used.
Let's go from bad to worse. Go from bad to worse, Tom.
All right, so I have a public service announcement. A public service announcement on top of Tom's question. And Anthony, you can tell us if this is a terrible idea or not. But some of my colleagues at BU introduced me just this past semester to these little like minty popper things that you can like burst into your mask, and it's like menthol, and it makes your mask smell like minty and fresh, and it doesn't make the mask damp.
Don't click on that email, Jen. I'll tell you that. That's
I have them. No, I have them. I'll let you guys try them. They're these little beads.
I got to get you on my email list.
It works. It's amazing. It's amazing. Had I known this like 18 months ago,
Menthol beads. That's the answer. Menthol beads is the answer.
You push them in your mask. So Anthony will tell us all right now if we shouldn't be doing that, but it's certainly better than breathing my lunch back in. That's all I'm saying.
Right.
That's all I'm gonna say.
If it's not making it damp, I would say go for it.
It's not making it moist, and it is not a Tide Pod, Matt Dugan. It's not a Tide.
I do have.
But you know what? You're servicing. She's servicing her mental health. If you feel better about it, then go for it.
Yeah,
so there you
exactly.
go.
All right, Sam has a real question.
Yeah.
I feel like I need to raise my hand. Thank you for staying on the line. Okay, I did post all Melrose students and Melrose Public Schools staff at home. All positive at-home rapid antigen results should be reported, and I have the link for that for positive. So thank you I did have to dig through. It came through in a December 30th email. If anybody wants to go back in their email history, but the question that I have is, or the statement, I guess, and then question. So before you arrived, we were going through kids at the Lincoln. The year before this school year, we were closing out the school year when in a very unknown, unvaccinated child situation. And our schools were we were like half in, half out. And then all the kids were in for the most part. But the classrooms were very mindful at that time. The desks were separated. They ate snack and lunch at their desks. They went out as often as they could, but they were really, again, very mindful of kind of reemerging into what was normal before. When we started this school year, also before you started, before day one, these desks were in pods again, where they're facing each other. They're in these little, again, this is elementary, they're in these pods. And now, recently, last few weeks, they've reintroduced the cafeteria as a place for children to go to have lunch if they can't go outside. So I am all for trying to figure out the world, and I know that things change on an hourly basis, and I'm usually a very patient person, and I know everybody's doing the best they can, and a lot of grace and patience. It's true. Well, I do, Tom.
Not patient.
But with that said, I felt like we already did this. Like, we already figured out how to be super mindful and careful with these children in these buildings. Yeah. And then we kind of like blew it up a little bit. And now I personally have one kid who has now been through 2 close contacts in the last 2 school weeks. the second one today, everybody. And they both happened during lunch when their masks are down.
In the cafeteria?
In the cafeteria. Like they're
Yeah,
separated enough. And I keep thinking, like, why, we had the answer. We like kind of could figure this out. So
have we just burned out? Or like what? Yeah, I agree.
I dug a little bit into it because now they're looking for it's like, if you want to be a lunchtime monitor during your work day, it's $25 an hour if you want to head into the schools to do that work, which I appreciate. And I appreciate teachers needing the break and all of that. But somewhere in there is a priority that I just can't suss out now that we're in our second close contact because of this lunch situation. So you don't have, that's not a question. You don't have to answer unless you want to.
I was going to say, what's the question?
Can I answer it?
It does feel like I do worry about, the schools and kind of administration and the rules and the way, they have a responsibility to that. So I can't really speak to that, but it just in terms of public behavior, it does feel really mentally and emotionally difficult. You can just see that it's really hard for people to keep doing this and to kind of go. It feels like such a step back, and we knew it was coming. I mean, everybody told us it was coming, and yet it's just it's weary at this point. It really is.
So I have a question then on that point, because it is a good point. I've heard from various people, friends or whoever, but there's this sort of a homespun notion that if everyone just gets sick, and no one's going to get really sick because this is less severe than other strains, then it's at the end of that, it's better. Everyone's then beyond it, and we have herd immunity. And so is that true? Should we be thinking in terms of at some point we're all going to get it, so we should just get it and then it's over? Like, is that really true, or is it? I mean, that's what I've heard.
Right.
So, what's the myth of that, or the truth of that?
So basically, if we're looking at past pandemics and we're looking at just herd immunity in general, and looking at this virus, the conventional wisdom is that once we reach about 85% of folks that have been exposed or vaccinated, that's going to be at the level of herd immunity, right? But the problem with this notion is that it's not going to happen at the rate, and we shouldn't be trying to infect folks, intentionally.
Right.
I think that's we should put that out there first.
Just to state that for the record.
Just state that for the record. Let's take that into context. But I think if we're talking about having folks have a herd immunity, the folks that are unvaccinated right now, the virus, when it gets into somebody, it replicates, and it replicates with errors, and that's the best way to explain what a mutation is, right? And so the Omicron variant came from one of these instances, or multiple of these instances, where it's infected an individual, it's replicated, and it's created a new strain. The other thing that is not talked about enough, I think, with the Omicron variant, besides the fact that it may be slightly more mild, is that it has a higher chance of reinfecting individuals that have already had it before. Yeah. And so folks can actually get, COVID multiple times. This has already been seen with Delta variant before, and now Omicron has actually had a quicker, a more efficient way of actually reinfecting individuals that had it. So we've already seen multiple cases where there are folks that had it before, and their protection has waned, whether they got vaccinated or not, and then they got infected again. And so that's part of the problem, is that we're going to keep in this cycle as long as we don't get enough folks vaccinated. The natural immunity that comes from infection from COVID is still not well understood. There's some level of protection for about 90 days, from anywhere from 90 days to 6 months, right? But that's different for every single person based on your immune system, based on your factors that contribute to it. That protection is not uniform, and so that's the reason why vaccines produce the strongest response in the immune system. And so that's why we can safely say that, for 6 months, after 6 months, you should get a booster, which will recreate that, strong resistance.
Right. Thank you.
So just one of our family gatherings over the holidays got canceled because there were multiple COVID infections in a household, people who weren't living together, kids away at school or moved out or whatever. And one of them had it for the second time. One of them had it for the third time.
Yeah,
definitely.
Is this what they mean when you hear people talking about we're moving from pandemic into endemic? Is that kind of what this Is that what that means? You know?
Yeah, so there's this notion that, you know, we're eventually, and it's not entirely wrong, is that eventually this pandemic, COVID might be around just like the flu eventually, right? But we've seen COVID take a lot of lives in the meantime, right? So should we be, you know, we should definitely be more cautious than just saying, oh, this will be with us forever, essentially. We should still be cautious because there's still folks that are at higher risk,
Really
right? So
vulnerable,
anybody with underlying conditions and older folks, you know, where we do want to be optimistic in the fact that now we have tools to combat this that we didn't before. Vaccinations, boosters, you know, that'll keep folks safe. But also, there's these pills that are coming out, these antiviral pills. These are more last resort things. But you know, these are all tools that are showing us that there is a light at the end of the tunnel. Even though
is that a therapeutic? Just to this
yes.
viewer's question, is that a therapeutic? The pill. The one that came out from, was it Pfizer?
I think Pfizer and Merck both developed a antiviral pill treatment. So this is one of those things that has limited availability. It is only prescribed to those who are infected and have a higher chance of developing serious consequences after, right? So this is mostly prescribed for 65 and older, those with, you know, underlying conditions. And so, you know, the efficacy of this pill is actually very much tied to when you catch the infection. And so if you catch it in the very early stages, this pill will be effective. If you catch it a little bit later, after the infection has already been there for a day or two, it won't be as effective. And so we want people to, you know, understand that, you know, there is a treatment. It is not a safety blanket. It's not, you know, it's not definitely going to work. And we want to make sure that hospitalizations stay at a minimum. We want to make sure that folks do not get to that point.
Right. Just because we have cast doesn't mean you should go out and break your leg.
Exactly. That is
I don't know.
No, that's really good. And I think, what Tom Shampoo was trying to say earlier. I agree. You know, we're still all trying to be careful and doing all the right things. I don't think anybody's advocating for being reckless in any way. But I certainly know that my feeling, if you had asked me like a year ago, because I have a little bit of asthma. If you had asked me a year ago, I was terrified. I was like, if I get this, I'm going to die. I mean, I was really, really terrified. And now I feel like I'm continuing to do all the right things. The toolbox, like you talked about. I'm wearing the mask. I'm doing the things. I'm being careful. And I also feel, I don't want to say resigned, but I also feel like I won't feel any, stigma or shame, or like, I just feel like if it comes to my house, I will still feel confident that we've done all the right things, and I'm confident that my family will be, safe and healthy, and we'll get through this. And I won't be surprised, I guess, at this point, if it comes through. We're just seeing the numbers, being so high. I think there's a lot of people that feel like just braced for it, I guess is what it feels like. Like I'm far more braced for it at this point than I was before, I guess. I think is what
I think I would add to that, Jen. I feel the same, but also more willing to, I guess, not take on unnecessary risk, but to go out and about and so I was very reclusive in those early days. And, geez, we'd go and get groceries and come home, and, one person would go to the grocery store and you wipe everything down. And, it was like, and there are more tools in the toolbox. And I think sort of braced for it is a good way to put it, Jen, but also like, there's less I'm not going out and doing risky things, but there's less things I'm willing to sort of put aside in order to, whatever. You gotta live your life and do things. You don't have to be
spraying down my groceries anymore. I mean, there's things we know differently now, right? Like I'm not quarantining my bags of chips and stuff anymore, right?
Yeah, but anyway. maybe I wouldn't go out to dinner, but now I would go out to dinner, or I don't know, something along those lines. This is maybe not the best month to
right.
For dinner, but just as an example, I don't know. I guess now that I'm thinking about it, I'm not doing too many crazy things. Other than
I sweat. I don't leave my house right now. I got my nice shirt on and my sweatpants on the bottom. Anyway, it might be a rough January, but I think we're gonna get through this and get through it together. We should go ahead, Sam.
Yeah, no, I was just gonna say, like, I know we're we're all trying to forecast this transition or what this will be like when things kind of level off a little bit. But just to be mindful that, to Anthony's point earlier, that there are still a lot of unvaccinated or undervaccinated or immunocompromised individuals that are still living with this as if this is a life or death situation. But for us, maybe it's a cold, and we can be flipping, try to only catch it one time or whatever. But there is a general population out there that is still this is still really risky for them. So I don't know if you have any comments on that, Anthony, or
yeah, I mean, it's difficult because when we talk to folks, and they're, for folks that may not see sometimes the bigger picture, right? And really, we wanted to understand that you probably know somebody, maybe not in your immediate network, but somebody, tangentially, some, connection of connection, right? That probably is struggling, and is struggling quietly, right? Because they're trying their best to stay safe, and it's not about suppressing rights. It's not about us trying to make you wear a mask all the time. It's really more protecting yourself, but also maybe those that you actually do care about, but you don't know that they're actually they don't want to speak up to say that they're afraid of catching it because they're afraid of serious consequences, right?
Sure.
So we want to make sure that everybody understands that we're all doing this to protect each other, and I think that's the best way to put it.
I have one quick question before we go, because I know that we're over on time. But what's the percentage of people who are getting one shot, the first shot, but not getting the second shot? Is that a big issue in the vaccine world with this? Because it feels like if people are getting the first shot and everyone gets a second shot too, then we should be making progress there. But I wonder how many people are not getting that second shot.
So generally, it hasn't been, at least in Melrose, I haven't done much digging other places, but generally in Melrose, we haven't had that much of an issue with folks not getting their second shot. It's generally been a pretty small population. We have been able, sometimes there has been cases where they've missed their second shot appointment or something, but we've been able to help them try and find alternative measures if they're trying to go to CVS, Walgreens, somewhere, right, to get their second shot. It hasn't been as much of an issue.
All right, great.
I have to say that back to the booster shot clinic that you ran. So as this was ramping up in recent weeks, there were a number of people at work who live in different towns who were like, geez, just the talk around the water cooler or whatever was like, it's hard to get an appointment. So I sent the link to the Melrose Clinic to several people who found it easy to sign up, get a slot. And each one of them has said how just well run it was. So just kudos to you and the team who did that. Everybody was very
You are
very
so
impressed.
welcome. It was so our table was very efficient.
let me give Sam here a shout out. She was definitely there. She was one of our.
Oh, is this another Sam behind the scenes initiative? I should have known.
I just sat at a table.
No, that table. I mean, it just everybody. A lot of our efforts are completely because of volunteers. They are amazing. We have this great group that is, sometimes they're more eager than we are. We're going to say, we got to take some time. We got to make sure we plan things. But all the volunteers are just ready to go at all times, and we can't say enough how thankful we are to have such a great community of volunteers ready to help.
That's great.
So,
well,
it's one of the
But it's those things that these people never had any other reason to come to Melrose, and I think you walk away with a pretty positive impression. So whatever your interaction is in town, and so it's great, and everybody liked Memorial Hall too.
Yeah,
which is a great place for a concert or a wrestling match or all kinds of things.
Or a booster shot or a health clinic.
Or a health clinic.
We should let you go, Anthony.
Yeah. Thank you so much.
So many questions.
Appreciate you being with us. This is what Melrosians are talking about. So thanks for being with us tonight.
Really appreciate it.
Thanks for doing all your work. And like to have you back sometime to talk about the broader picture as well, because I'm sure there's a lot of other things under the umbrella of public health that we should be talking about and thinking about. And I just want to last comment. I was very, it was nice to hear about your strategic plan, because I'm sure you're shaping that on all these other fronts at the same time you're dealing with the crisis of the day. So thanks for that. We'll look forward to hearing more.
We'll send Karaji your contact information if he has any follow-up questions.
That sounds good to me.
All right.
Did anyone tell you about the dancing?
Oh yeah. No, I don't think so.
That's how we finish this show. So get your chair dancing moves ready.
All right.
All right, Anthony, thanks again. And everybody will see you around town.